Burnout isn't the end. A survival blueprint for new or early stage healthcare administrators overwhelmed by staff burnout. Listen, you just got the title, but no one warned you what it would feel like to lead a team running on empty. A hard truth, you're not just managing schedules. You're managing exhaustion, fear, and fading morale. Your team is emotionally tapped out, and as the leader, you're expected to hold it all together. You're not alone, and burnout doesn't have to be the end. In fact, this moment could be the beginning of your greatest leadership breakthrough. In this video, I'm sharing a practical survival blueprint specifically for new leaders to help your team recover, rebuild, and rise stronger than ever. Stick with me. There's a powerful, actionable step waiting for you at the end. Let's break this down. Why burnout is hitting you so hard. No one prepared you for the emotional weight of leading through burnout. What you're likely experiencing right now is staff disengagement, constant turnover, and pressure from upper management, as well as a lack of a clear roadmap to rebuild morale in the first place. The deeper issue, though, burnout isn't just about long hours. It's about disconnection from purpose and unprocessed emotions, as well as feeling unseen. But what if you could reverse that emotional spiral without burning out yourself in the process? Here's a blueprint. 3-step survival plan for new leaders. Here's how to take back or get into flow of that control so that way you build alignment and create a culture where your team actually thrives. Step 1, reconnect your staff to their worth. When staff feel like a cog in the wheel, they just check out, right? They check out. But when they feel their worth, they lean in. And a strategy that can help you with that, use personal check-ins to ask your staff what part of your work feels meaningful, as well as align roles with individual strengths and passions when it's possible. Another thing you can do is share impact stories. How a nurse's empathy helped a patient recover faster. How reconnecting staff to purpose can reduce burnout. Step 2, implement a resilience framework from day one. Day one you get there, are we ready to hit the ground? Resilience isn't just something you bounce back with. It's something you build, right? And a strategy that you can use to help with building resilience, start your team meetings with a 2-minute mindfulness reset. Also use weekly resilience prompts like, what challenge did I face this week and what did I learn? So that way you're having your staff members do this. Also, offer micro trainings on emotional intelligence and conflict navigation. These are all things that we already include in our program for the healthcare industry. And step 3, strengthen well-being culture with real action. A healthy staff doesn't just happen. It's nurtured by consistent, visible leadership. And a strategy that you can use to help with this, introduce well-being logs where staff can track smaller daily self-care, something we already offer in our healthcare packages, training programs for the healthcare industry, as well as reward follow-through, not just the outcomes. Conversations are, we align personality and professionally because you want that. You want successes to be personal and professional. How leaders who promote self-care get better performance. Welcome, I'm Mrs.P, aka Dr. Retention, here to help new healthcare leaders like you not just survive, but lead with clarity, compassion, and confidence. If you're building a team that you want to see thrive, hit that subscribe button below so you don't miss strategies like this. Think of future pacing, the transformation that you want to see. So what happens when you implement what we're sharing on this channel is the impact. An impact example could look like this. Teams that implement resilience and well-being frameworks, they see a 20 to 30% increase in engagement and up to the higher this. Imagine walking into work and you're hearing the laughter in the break room again. Like your superiors have told you how it looked and how morale was going downhill fast. But you're going in and you imagine that you hear the laughter coming from your break room. You're seeing your staff stay late, not because they have to, but because they're supporting each other. They want to do that other part, going above and beyond. And coming up, one mindset shift that every new leader must make to prevent leadership burnout. You got to take care of you too. So here's that bonus tip. The compassion filter. When overwhelmed, most leaders ask, what do I need to do? But the real question is, what does my team need to feel? See, the compassion filter method, before responding to complaints or problems, ask yourself, is what I'm about to say going to build trust? Right? Think Rogerian, the psychologist's method that focused on person-centered. So implement it from that place right here. And so when you're thinking, well, will it make them feel valued or just correct it? Does it reinforce the emotional safety that they need to perform well? And know this, when you lead with compassion first, great performance should follow. Listen, burnout isn't the end. It's your starting line for transformation. So 3 next steps I want you to take. Comment blueprint below. And I'll send you a free staff resilience tracker. Now, if you learned something today from these strategies and solutions that you're going to want to put into action, then raise your virtual hand by completing these next 3 steps. Step 1, comment and we'll send you a resilience character building tracker PDF so then you can email it out to your staff to start using right away. Step 2, click the link to book a 15-minute strategy call. And step 3, subscribe and share this information, this channel, with another leader who's feeling overwhelmed right now. See, because when we know how to do better, we definitely should share with others so they can do better as well. Because when we know better, we do better. Step 3, subscribe and share this with another new leader who's feeling overwhelmed because you know you're not alone. Take care. Thanks for listening.